Hi, welcome to Motivate Therapy's What to Expect Pelvic Floor Therapy for Female Pelvic Health. Congratulations on taking the first step on your health and wellness journey. Knowledge is power. This is how you decide whether pelvic floor therapy is the right thing for you. No one ever wants to talk about this stuff, and it takes an average of 5 years for a woman to talk to their doctor about anything going on down below. So anything having to do with your vagina or having sex, peeing or pooping is not something that we want to talk about. So this is learning about what to expect from pelvic floor therapy from the safety of your own home. Don't be a statistic. Learn more about how you can help yourself today. Motivate Therapy is a group of like-minded people dedicated to helping you achieve your goals and change your life. We are occupational therapists and physical therapists, and our philosophy is that you cannot change anything that you're not aware of, and so motivation and education are the key. Therefore, anybody can change their life no matter their age or stage. Hi, my name is Denise Nichols, and I am the owner, director, and occupational therapist at Motivate. I've written a book called Your Self-Care Matrix, which just highlights the steps that you can take to change your life today. We don't want to think or talk about anything going on down below, but if you can understand today that your pelvic floor is part of your deep core, and so truly what pelvic floor therapy is core re-education. So thinking about it and talking about it is how we change it. And because your pelvic floor is part of your deep core, it is rehabilitation. Just like if you were to have back therapy or therapy for hip pain, pelvic floor therapy is an essential piece to core muscle re-education, no matter if it has to do with your hip or your back or your vagina. Therefore, pelvic floor therapy is covered by insurance as long as you have a referral from a medical provider. And all it really truly requires is dedication and commitment to change from you. Pelvic floor therapy works. It just takes you taking the first step, raising your hand and having the uncomfortable conversation, whether you're having urinary leakage, difficulty or pain urinating, constant urge, pain or difficulty with vaginal penetration, bowel dysfunction such as constipation or fecal incontinence, anything having to do with your pelvic floor, therapy works. You can change it. It just takes a dedicated team like us. I believe that every person on their health and wellness journey has the right to expect to be heard, to expect results, and to expect continued resources and support. And that is what we provide at Motivate. That is what you can expect when you come to therapy for any condition. By the time people find pelvic floor therapy or us at Motivate, they are extremely frustrated and hopeless very often because they don't understand their symptoms and they're not finding anybody else that is helping them understand their symptoms. And that is what we do. Your signals over time become symptoms. Your body is always talking to you. So we help you understand that so that you can therefore create change and eventually even think like us. So there are no limitations as far as you are not too old or too overweight, not flexible or coordinated enough. You can create change today. You just need a team of people to help you understand it. And that is how we see ourselves as guides on this journey for you. We do ask that you come with an open and positive mindset because that is everything. And as well, we ask for you to bring your list of medications and past medical history because all of that is part of this. Please understand that you are not alone. 1 in 3 women over the age of 18 will have a pelvic floor muscle dysfunction at some point in their life, whether it's leaking urine when they run or pain with intercourse or simply hip pain. You are not alone. You have found your tribe. Very often, if you're not asking, then they're not telling. Baby gets an average of 8 visits in their first year of life, and mommy gets 1. So this is the time to talk to your medical providers about anything that's different from your norm that's going on down there during pregnancy and after childbirth. Things such as urinary leakage, pain or discomfort with intercourse or orgasming, anything that feels different or out of control or uncoordinated. Don't be satisfied with just do your Kegels. Listen to your body and find what works for you. Therapy works. Awareness is key to creating lifelong lasting change. So in order to meet your goals, we hand tailor your session with a very individualized, detailed initial evaluation, but then we continue to assess and reassess with every session. We want to know what's working and what's not working because it's your life that we're trying to improve. So you can expect results very quickly with our proven strategy, which includes the 4 pillars of our treatment approach. So first, we're going to look at your behaviors, which is extremely important. What habits are supporting you and what habits are no longer supporting you? So this includes the 4 biggies, which is water, fiber, sleep, and stress management habits. And then we want to know your tissue health. Muscles need blood flow to be happy and healthy. They need blood flow in and lymphatic flow out. So using manual therapy techniques, we can help improve your tissue health and then teach you how to maintain it on your own for lifelong success. Posture, how your chest is aligned over your pelvis when you move and function. That's a huge key that you can bring awareness to and change today. And then the last, but certainly not least, is looking at your core coordination. So it's not, again, just about strength. It is about coordinating length and strength. So flexibility and strength. That is what we look at in order to create an individualized plan for you. And therefore you see results. I believe that a very detailed, thorough, hands-on initial evaluation is what sets the tone for a successful completion of plan of care, therefore meeting your goals, changing your own life, and then knowing how to maintain it on your own once you're discharged from therapy. So come prepared to answer a lot of questions. You may be surprised to understand that your past medical history, such as surgeries and falls and childbirth, and even medications can play a role in your symptoms. After that, we're going to take a look at your posture, as well as your range of motion of your spine and your hips. And then truly understanding your muscle strength and coordination is really important. So either on day 1 or day 2, we will do an internal vaginal assessment to look at your pelvic floor muscle coordination. So not only how hard can you squeeze, but how well can you relax, because that determines the strength of the next squeeze. Most importantly, it's how well you coordinate. So when you cough, do your muscles tighten or do they open? Do we see organs drop, which could be indicative of a pelvic organ prolapse? Is there a difference between the right and the left side? Truly an internal assessment is what pelvic floor therapy is about, and is an integral piece to helping you achieve your goals and to really making an individualized plan for you. I think the fear of the internal assessment and really the unknown often stops people from coming to therapy and therefore changing their life. We will never do anything that you do not want us to do. So it can be avoided, and we can get other information in different ways. But it truly is the best way for us to understand the cause of your symptoms and how we can individualize the program based on your specific needs and what your body is showing us on that specific day. It is not something we have to do every single time, but it is an integral part of helping us establish a solid individualized treatment care plan for you. So we ask that you come up with an open mind. So if there is one thing that you walk away truly understanding at Motivate, is that everything is connected. Your pelvic floor is not an island. It is part of your deep core. So your diaphragm and your pelvic floor, as well as your low belly, your low back muscles, that's your deep core. And then everything around it can affect your pelvic floor and is affected by your pelvic floor. So understanding that coordination is more important than pure strength, that it's not often just do your Kegels. Often it's not doing Kegels at all. The only way for us to truly know is to do that thorough assessment. So expecting to be heard and seeing results does not stop on day one or once you graduate from therapy. We want you to continue to feel supported and have the resources you need to maintain lifelong success. So whether you're coming to therapy in the clinic or you need to stay safe and stay at home, you can do virtual visits through your smartphone or laptop. We are also constantly providing you tips and tricks to maintain your progress, whether it is emailing our newsletter, looking at all of our content on Facebook, Instagram, and YouTube, and then also taking a look at my book, Your Self-Care Matrix, to allow you lifelong success so that no matter what life throws at you, you have the tools that you need. If you still want to learn more specific to your symptoms, feel free to give us a call and set up a free consult, whether it is in the clinic or we can do it virtually as well. You will talk one-on-one with a licensed therapist to help better understand how we specifically can help you change your life based on your symptoms and your goals today. Take action today. We are here for you. Email us or give us a call and get started today. Bravo, great job. Thank you so much for taking the time to learn how to help yourself today. Thank you for spending this time with me. We look forward to working with you.